Okay, so let's set the table a little bit. In terms of the, a case per 1,000 or whatever, what is that benchmark for something to be considered a rare disease?
Right, so in the United States, it's less than 200,000 people have it. In Europe, it's about 50,000. So, when we think about it, one of the cases that we might talk about is one of the ones that came out of Nationwide Children's Hospital, Zolgensma, for children with spinal muscular atrophy, for example. That affects about 1 in 10,000 kids.
Wow. And in your research, or just in the research literature, are most rare diseases connected with something that develops at birth, or is it kind of something that you could potentially develop later on in life and early detection really matters? What are you seeing in terms of a mix?
Lots to unpack in that particular question. So
that's why you're here.
So let's start a little bit on the beginning. So, oftentimes many diseases don't present themselves until a few years after birth, but there are some that present very, very early. And we'll talk about a little bit about one of those that we're developing at Forge, which is for infantile Krabbe disease. It's lethal. Most of the kids die by the age of 2 or 3, and there's nothing really else out there for them from a genetic standpoint. And we have one of the first of its kind in the world being developed at Forge, and it's currently in clinical trials now.
Okay.
But you asked another question, right? So it's more about how do we think about that approach? How do we think about trying to find those kids that have those rare genetic disorders so we can treat them? One of the mantras that we have, I think, in gene therapy that's been really elucidated over the past several years has been the earlier that we can intervene in a genetic disease with a genetic treatment, probably the better off for those kids, because the damage will have been prevented rather than trying to correct it afterwards. So, and that's where we really come back to newborn screening. Right, so newborn screening is something that many rare diseases don't have, and we're trying to find more and more ways that we get more and more rare diseases on the government or even the state's list to try to find kids very early.
Yeah. So we're going to do a lot of unpacking on this show. We're going to have a lot of fun.
Great.
So I want to go to the issue, like you said, the dread of parents, right? The doctor going in telling them that their beautiful baby has a very rare condition with no treatment options. A lot of those conversations, at least in developed countries, start even before you decide to have a kid, right? Some folks opt for genetic testing to look at risk factors. Where are we as a healthcare system in really access being available to a lot of people doing some of those things, either before they decide to have a kid or during pregnancy? What are your thoughts on that?
Well, I think you highlighted one of the key questions is that a lot of times, depending on someone's background, genetic background, they know that there's risks in their family, right, for some form of genetic disease. And so oftentimes people will go and they'll try to do some form of screening ahead of time to make sure that they know the risk profile, right? But what you're really talking about is access to some of these new therapies, and how do people get access to that? And that's one of the reasons why we work through the clinical trials, right? So we work with hospitals, we work with the FDA, we work with regulatory agencies to undergo these investigational new trials to basically test to see if the new drug will be safe first. Then you check in to see if it's got some efficacy.